All right. I believe we are live. Good evening, everyone. Thank you so much for joining us. Welcome back. We have been taking a little break for the summer. It has been an amazing summer. I actually just got back yesterday afternoon from Greece. And so it was a beautiful, beautiful time away. But I cannot tell a lie. I missed y'all. And so I'm so excited to be back, and I'm really excited to be back with yet another amazing health tech company. You know, we've talked about what recession proof really means. And as we're building our portfolio, we're really doing it mindfully. You know, that was how we entered into 2025 is deliberate and intentional, right? I said that when we first started the year off, is that we were really going to be thoughtful about the projects that we brought in front of you, because we know that the state that we're in economically is challenging for many, and we wanted to really think about those recession proof additions to our portfolio. And so we've really leaned into health tech and real estate, and and some other opportunities. And so I am so excited to introduce yet another amazing company doing amazing things in the healthcare space. I want to introduce to you all Sharon Samjitsing, who is with Healthcare Original. She's going to tell us all about that and all about the company that she's built, the amazing company she's built. And as you guys hear more, you'll be able to ask questions. But I wanted to first welcome everyone back. For those of you who are watching us in Facebook, next time you need to come on in the Zoom so that you can ask your questions in real time without any delays. And also so that you can be right here and we can see you and you can see us, right? We love to have everyone here in the Zoom, as many people as possible. For those of you who will catch the replay, we will have that sent out as soon as the recording renders. And if you have any questions, please don't hesitate to either put those in the Facebook live stream, or when I go to the WeFunder page, we'll talk about where you can post your questions also, so that the founder can answer those for you. Okay? But it is wonderful to have you all back. And let's get this party started. So I am going to share my screen. We're going to take you to the campaign page. It is on WeFunder. As you guys know, WeFunder is probably the most visited portal that we've gone to over these last 5 years. They do an amazing job highlighting some amazing companies, and we are happy to yet again visit there. As you can see, this campaign has done a wonderful job raising capital. So Sharon, congratulations. You're almost at your goal, and we're so happy that we can be part of this journey with you. Over $2.3 million raised, the goal of 2.8. She's almost there, but she still needs a little more help, and that's where we come in. And so excited that we're able to be a part of this amazing journey. As you guys can see, this is an AI-powered wearable and virtual care, and it's prevention of asthma and COPD. And Sharon's going to talk a lot more about that. This is a priced round. You guys know I love a good priced round. And so the price per share is 1.517, excuse me, 1.5175. There are some perks for the campaign. You guys know I always tell you, read the entire campaign page. There's a lot of great information here. There's a video you can watch. There are already some questions, I believe, that people have asked, quite a few questions and answers. And I always tell you guys, not only can you ask questions here in this section, but you really should be reading the questions that others have asked and then the answers that they've received, because you learn a lot from this section. This is probably my favorite section of a campaign page. And as you can see, people have been busy here. So there's a lot of good information here. 76 questions have been asked, and Sharon has answered all of them. And so I really, really want you to spend some time here. This is going to be a critical part of your due diligence process. All right. So I want you to look at all of the information here, the details, the overview, everything here. All right. There are also some investor perks to be mindful about if you're interested. So take a look there as well. And Sharon, when is the deadline? How long is the campaign open?
The campaign is open until September 28th.
Okay. So we've got a little bit of time, but you guys know what I always say is you don't want to wait. We have experienced in the past where campaigns had a couple of months left and all of a sudden they received the influx that they needed and the campaign closed and we missed opportunities. So if this is something after hearing the presentation and doing your due diligence that you are interested in, I'm a firm believer. It doesn't make sense to wait. So you want to get in and add this to your portfolio if that is what you see fit, right? With that said, I am going to
So,
stop sharing and
Juana, can I just
Mhm.
point out one thing on the page, if
Absolutely,
that's
my
okay?
dear.
Can you scroll down? So one of the things that I'd love the community to know is that we are actually the first campaign on WeFunder. You probably scroll all the way down to the warrants section. We're the first campaign on WeFunder to offer warrants. And we did that because our lead investor, which is a VC, actually has warrants as well. And we were clear that we wanted to offer the community the same terms as our lead investor. So
Wow.
what we have is every time you purchase a share, if you are a VI, I'll wait for Tawana to get there so we can
And
see the
let me get
section.
there.
It's way down at the bottom. Yes, I am Trini from Tracy. I am Trinidadian, and I refuse to get rid of my accent. So, right. So
There
there you
we go.
go. So, WeFunder VIP members actually have a unique opportunity where every time they purchase a share, you will actually get 1.5 additional warrants that convert into shares. So for that $1 and 1.5175 um, price, you get 2 cents, a 2 cent warrant, 1.5 times 2 cents warrants on top of that. So fundamentally, for the price of one share plus 2 cents, you get 2.5 shares. And every WeFunder VIP gets that. If you're not a WeFunder VIP, you still get an extra zero point 0.5 times warrants at the 2 cents, but of course it's less than the other one. So it's a really, really good deal. And we fought really hard to get WeFunder to get us that permission on the platform. So like if you invest $100, you can see the math here, you actually get shares and you can be a WeFunder VIP or not. But we're really proud that our lead investor actually agreed to this and that we got it through WeFunder. We're the first campaign ever to offer warrants. So a
Yeah.
really good deal.
Wow.
Yeah.
That's absolutely wonderful. Congratulations on that. That's
Thank
a
you.
big deal. That's a big deal
Yes.
that you were able to get that.
Yes.
And I would imagine now that you've started a trend, we're going to see more of this, which is great from an investor standpoint. But warrants are wonderful. They typically are a perk only given to the lead investor. That's the perk of being a lead investor, one of the perks of being a lead investor. So to be able to share this with the general investor pool is absolutely amazing and a testament to the type of founder you are also and how you really care about your investors. So that's wonderful, Sharon.
And thank you for allowing me to do that. It really is we're in this to make everybody to write what is it the thing? A rising tide lifts all boats.
Yeah,
And we have to do this together. All right. Thank you very
wonderful.
much.
All right. Well, I'm going to stop sharing and I'm going to
Okay.
turn it over to you, my dear, and let
All
you
right.
tell us all about this amazing company you've built.
I'm so thrilled to be here and thank you, Tawana, for I did not know about you. So I'm so thrilled that Tawana reached out to me and now I get this opportunity to present to all of you the thing that is really my life's mission and passion. Um, can you see my slides in full screen mode?
We see now they are full screen. Yes.
Okay, great. So Tawana did a great job of introducing us already. You know we're on WeFunder, and my company's name is Healthcare Originals, and our goal is really to monitor give people insights, and promote better health. You know already from Tawana that we're looking at respiratory care, specifically asthma and COPD. And the reason we started with asthma and COPD is because I have asthma. I've had it all my life. I almost died 5 times with it, more than 20 ER visits. I don't know how my parents were sane when I was a child, but I mean, between the ages of 4 and 29, I really didn't know like what to do with this. And I remember the first time I almost died, it was a Mother's Day, and everybody was getting ready for church and a nice lunch out, but then I couldn't wake up. And so they had to rush me to the hospital. I ended up being hospitalized at the age of 5. And I remember looking at my mother with her head bowed and crying, and like I was on oxygen, and she looked like she had aged overnight. And then my sister tells a story. So she's 4 years older than I am. So she's 9 in the back seat of the car. And she says, my dad pulled the car aside and just broke down sobbing because he had almost lost his child. And my dad grew up in really hard times, as a Trini would say. There's a Trini in the audience, so they know what I mean. Um, he grew up at the end of World War II and had rations and was abandoned as a child. So the fact that he could cry for that tells you just how much this meant to him because he could have lost his baby, right? And these diseases, more than most, are thieves of joy and peace of mind. And you will not meet a more motivated founder who wants to make sure that people just don't have to live like I did. What I tell people is now, it took me 25 years to learn how to live well with this disease. Now we help people do that within 6 months to 2 years. And I cannot stop and I will not stop until we improve outcomes for everybody. And so what we hope in terms of what we do for the people who use our solutions is we give them real freedom from the chains that are really binding them in the context of their respiratory disease. And we have we have a couple of solutions. So before we started selling this solution, we used to sell to pharmaceutical companies in clinical trials. But the solution and the product line that we believe is going to scale and get us the exit and the outcomes that we want. We call that Nightingale Virtual Respiratory Care. And sometimes that confuses people, but the company's name is Healthcare Originals, and we envision that it's a house of brands. So think about Procter and Gamble. It's a big company, but they have all these brands like Tide, etc. Or IHG is the big hotel group, and then they have individual brands like Holiday Inn Express, Holiday Inn, and a bunch of other things. We are HCO. We're a family of brands, and one of our brands that we're scaling to exit is Nightingale Virtual Respiratory Care. And what that is our proprietary device, which is an AI-powered wearable combined with a virtual care platform that is clinically proven to eliminate respiratory attacks. And as Tawana said, we've been having a really good time on Refunder. And because of that, we've been featured in Forbes and King's Crowd, which the community will know is like tracking every crowdfunding campaign out there, has named us a top deal. King's Crowd Capital has invested. And last week we made number 21 on their leaderboard in terms of the numbers raised. And that goes to the point that Tawana was speaking about. There are two things that fuel that. We're coming to the end of our raise, but also the VIP terms that we went through before this, those are actually going to end. We have only about 60,000 left on those. So we're seeing a lot of activity on people wanting to get the best deal. So if you hear my story, or if you see people on TV, or it seems like attacks just happen out of nowhere, right? Even on TV, you see people start gasping for breath, and then all of a sudden they take an inhaler and they smile. Well, that's because when we have an attack, we actually have no choice but to be aware of our symptoms. But what I tell people all day, every day, is we breathe 20,000 times a day. If we had to think about breathing, we couldn't do anything else. But actually, what is happening is that our symptoms are actually undulating over time. But imagine a busy mom getting ready in the morning and getting the kids back off to school. It's easy to excuse shortness of breath or a stray cough as, oh, I'm out of shape, or I was just rushing this morning, those kinds of things. All of those things are indications of fluctuating symptoms, but we tend to ignore them until we literally can't. And so where we win is we make that invisible symptom fluctuation visible for everyone. Our proprietary technology, which I'll get into shortly, has been proven to predict attacks or healthcare utilization for attacks up to 3 months in advance. So what we do is we basically transform the experience of this seemingly suddenly sudden attack, and we create ways for people to actually soothe those undulations and really reduce the incidence of things elevating to an attack. You could consider with our technology, what we're doing for respiratory is what continuous glucose monitors do for diabetes. So here I'm holding, you can see it on the screen, but I'm holding it in my hand. Unlike most wearables that you like have on your wrist or anything like that, it is soft and flexible. And this is fundamentally like a stethoscope on steroids. So you wear it on your upper torso, front, side, or back. I wear mine on my side here, hidden under my clothing, and it's invisible to everyone. No one has to know that you're tracking this thing. And for me and several of our users, that was a key thing that we learned. If you have these conditions, you're already tracking around inhalers. There are big things called spacers. Everybody knows that you have this. So do we need yet another indicator that we have this disease? No. So we made this invisible. It's one stuck on the skin underneath the clothing. And of course, it helps us to really gather deep organ sounds. So really the sound of your lungs. And so what we do is we listen like a stethoscope to those deep organ sounds, in this case, the lungs. And with our AI and machine learning on board the device, we're able to track symptoms and really provide actionable insights. And like I said, it's been proven to predict attacks up to 3 months in advance. We have 15 patents filed and 10 pending globally, and we've collected a lot more than 3 million data points to date. The key takeaway from this is not only how it works, but the fact that it works. 99% of hardware startups never bring a product to market, and we have done that successfully, and this is the technical solution is already working. We have been called a breakthrough in leading indicator monitoring. The background is this was developed at the University of Rochester with $2 million in NIH funding, and there were 3 clinical studies that showed how you could predict healthcare utilization up to 3 months in advance. So it's not just about the wearable and the great stuff that's onboarded, but really it's about the fact that we also have fully built out apps and web portals and all of the good digital things in the background. We track coughing, wheezing, chest tightness, and shortness of breath. And we put that together with activity and temperature. So we form a unique baseline for the individual. So when they're trending away from that baseline, we're able to see that something's changing, and then they have an opportunity to act that window that we showed earlier on. And so it's really just a way to really have everybody track, and the app is very feature friendly, and you get to see everything, and you can drill down and see your tracking and trending. So the solution, the hardware and the software is completely built out. But I'll tell you what happened. I'll go back a little bit. So when we first started this, we are actually the first company in the world that was able to do coughing on a wearable device so you could track it in real time and in real life. I kid you not, before us, the solution was somebody recording someone in real time. So they would strap a recorder on somebody like a magnetic tape recorder, and then they would have somebody listen to the tape to count the coughing. So when we came into being, it was a great breakthrough for pharmaceutical companies, and they came to us, and we had a very lucrative business stream in 2019 and early 2020 around selling into pharma to help them with clinical trials. But COVID happened, and it gave us a chance to really reorganize and think about what we wanted to do. And our board also posited to us that we didn't start this to just do formal. We started this to make a difference for people with their lives. So we started to think a little bit deeper. And the question that always gets asked is, so the device tells me something is changing, I'm on my way to an attack. What do I do? And that's where we came up with the Nightingale solution. So we take the device, the insights from the device, and what we do is right at the point the device says something is happening, we deliver what we call hyper effective and contextualized self-management education. So imagine that the device says something, and then you get a text saying, hey, this is what we see. And remember, we talked about this. This is what you should do. What happens is that people start to put the symptoms that they couldn't track before together with what they should do about it. And that really creates that expertise where everybody becomes an expert at managing their condition, which is our goal. And what we do is that text management delivery is overseen and initiated by respiratory therapists. We have behavioral health therapists to help people with anxiety and wellness coaches to help people set goals. So, what you have is a complete system of care, and we have a national network of pulmonologists that we're building out as well. Most importantly is we provide components for social needs. So HEPA air filters, a lot of people with respiratory conditions, someone was mentioning earlier that the air quality is so bad right now. Sometimes people need HEPA air filters in their homes. We provide that. Or sometimes there are smokers in the house. Sometimes there's mold in the house. So we help to clean the air in at least one room so that the person has everything they need to get better. We provide Wi-Fi hotspots in areas where there is no Wi-Fi, and not well known, but insects and cockroaches in particular are actually triggers for asthma. So we help with pest control. So what you have here is a whole person health full solution that helps people to really become experts at managing their care. And the great thing about that, what we're doing now as a use of funds from this round is we're actually scaling with AI. When you go back to that diagram, we have these unique insights from our device, and then all of these tips that we know the respiratory therapists do that help people to get better. So what we have is we're building an AI agent that is creating these things so we can reserve our human touch for all the things that are important. So imagine that first undulation of symptom, the AI will alert. And then if it gets bigger, the AI will intervene. And then once that still keeps happening, then we get the respiratory therapist on board. And what that means is you get the best of both worlds. You get the same training as a respiratory therapist until such time as only a human can help. But that allows us to scale. And from a business model perspective, this is transformative for us. This is how we deliver care to millions, not just in the US, but around the world. And we just filed our first AI patent earlier in July, and we're so excited about that. And now the reason why we're able to train an agent is because nothing else works like this solution. You already know how differentiated it is, but in a validated study, we showed that within 12 months, 100% of people report fewer symptoms, 90% of them sleep better, and if you know anybody with these conditions, the attacks always seem to happen at night. At least my parents had that experience, and that's my experience as well. And when we think about people who were having attacks every month before they joined our program, 2 out of 3 of them report no attacks. We are the first wearable and the first respiratory solution to be validated by the Validation Institute for better outcomes. And what they have said is that they've looked at our data, all of these things are correct, and they have backed us with $100,000 guarantee. So if any of our customers, and we'll talk about our customers shortly, if any of them don't experience the outcomes that we guarantee them, they will pay them back up to $100,000. So that's the solution in a nutshell, including what we're building now with AI. But let's talk about the market size. So 50 million people in the US have asthma and COPD. There are 690 million people globally with this disease. And yes, our vision is global. The thing is, more than 50% of them have poor outcomes. So in the US only, we spend about $46 billion in things that could be avoided: ER visits, hospitalizations, and doctor's visits. And one in three patients with these conditions will have at least one emergency room visit per year. So not only is it costing us money, life generally sucks for most of the people with these conditions. And the thing that's interesting for me, um, because none of the protocols worked for me, they stopped working for me when I was 11. So I had to find my own way. I grew up in Trinidad, and so there wasn't all the prior auth problems. So my doctor was free to experiment with any new drug that came on the market, whether indicated for asthma or not, I kid you not, until we found something that worked. But we don't live within those same rules in the US. And what happens is that Black Americans are extremely affected. They're 5 times more likely to have ER visits, 3 times more likely to die from asthma, and Black women have the highest death rates. And this is my soapbox issue, but I'm going to say it. Studies have shown, including a study from 2018 from Stanford, that albuterol, which is the drug that most people take for attacks, for rescue, is actually less effective in Black Americans and Puerto Ricans, but it is still the drug that gets prescribed over and over. It stopped working for me when I was 11, but there's a reason why people like us are ending up in the ER. We need to have things that work for us, and that's what we're working towards. So speaking of Puerto Ricans, they have the highest rate of asthma prevalence. They're 2 times more likely to have attacks, and they face pollution inequity. American Indian and American Native, Alaskan Natives as well, they have really poor outcomes. So people of color generally are really badly affected by asthma. And in COPD, it's our women and our rural communities and those who don't live with a lot of money that are really being affected. So not only is this just a mission and a wealth building exercise, this is really about how we address these diseases that are affecting people of color in the United States and really all around the globe. The drugs were not developed for us, and we need to fix that systematically, find the things that work for us. And again, a soapbox issue here, but what I tell people is fundamentally the sound of our organs does not depend on our skin color, does not depend on our age, our size, or our zip code, or our gender. So it is really an unbiased marker, and that's why I'm so excited about it. If we are just listening to organ sounds, none of those things make an impact, and therefore we know the true indicator of what's happening. So I'll step off my soapbox now and then talk about the massive market. So 690 million people globally. That's a total addressable market of $83 billion. And we are focused on 63 million people with uncontrolled asthma in the US, the EU, and Canada, giving us a service addressable market of 18 billion. And when we capture 10 million people with uncontrolled asthma and COPD, we are going to obtain a market size of about $3 billion. The good thing, well, the good thing from a market perspective is that prevalence is growing at a compounded annual growth rate of 7%. So this is a huge market. Let's talk about our initial go-to-market. And it's very, very simple. We sell to companies that want to reduce the total cost of healthcare. We do not sell to providers who are working in what is called fee for service, only get paid when people show up in front of them. Since we are keeping people away from the hospital and the ER, we have to sell to the people who benefit when people stay away from them. And so those would be people like peers and health insurance, employers who stand the cost of healthcare, and any providers who are in value-based care arrangements. And we've had amazing traction in 2025, which is why our round has been going so well. We have $5.5 million in annual recurring revenue and signed contracts. What that means is we have these contracts now, and we're growing and building and using these funds to scale to meet that revenue projection. And we estimate we will do that within the next 12 months. In January, the Asthma and Allergy Foundation of America chose us to roll out our Nightingale solution in Texas. And I don't have to tell you, but I will tell you, when the largest advocate for people with asthma in the country chooses your solution to help underserved people in Texas, that's just supreme acknowledgement that what we're doing is highly differentiated and effective. In February, we started a school pilot in Pennsylvania in a school district where 100% of the people live at or below the federal poverty line, and where the incidence of asthma is as much as 25% higher than the national average. And the great thing about this is the perks from WeFunder are paying for that. We are also I think, one of the first or maybe the only campaign that don't just give you swag. People who are investing $5,000 and more at different levels are actually funding this pilot and giving back to the community. In March, we were selected as a preferred purchasing partner for a company, an employer healthcare purchasing coalition that covers 400,000 lives. You'll see that press release and talk about it on the WeFunder side as well. And just last week, we got approved for a value-based care contract that is going to be about $1 million in revenue. With everything that we have in the pipeline that we plan to convert, we have about 12 that, well, it's showing early signs of conversion. We have about $12 million of annual recurring revenue that we will contract and grow to actually having that revenue over the next 18 to 24 months. When you think about our competitive advantage, it's clear. There are others who claim to be in the digital health space, who claim to be maybe tracking organ sounds, but they have no validation like we do. They do not provide a whole person care solution, and they don't have the quite playful form factor and comfortability that we have and comfort level that we have. We have significant first mover advantage with an enhanced moat. We're the first company to come to market using sound as a biomarker to improve outcomes. We have a vast digital signature library. What that means is we have a vast amount of signals and sounds that we've captured from the body that allows us enhance other abilities to monetize, and we'll talk about that. We are the first to listen to organs continuously in high fidelity. So that unique database is ours and ours alone. And there are certain features of our wearable that make that data very accessible. So as we think about that, what we really think about as our big global blue sky vision is that sound is the new signal. Deep organ sounds are an untapped database in the real world. And I already got on my soapbox, but I'm saying it again. It's free from racial, ethnic, gender, or geographic bias. It's cost effective. It's non-invasive. Are we really going to give everybody a blood test to figure out their genetics? Or 8 billion or 7 billion people in the world? I don't think so. So this is a non-invasive and very cheap way to do it. And it provides a way to understand what's happening with the individual. So we call it a new scalable data layer for personalized diagnostics. And when you think about the organs in the body that make sounds, we're starting with the lungs, but there's the heart and there's the stomach. And we have every intent to grow our platform across those conditions that affect the heart and the stomach as well. So when you think about the respiratory market, we step through that. It's a 3 billion service obtainable market. You add those things on, we grew to $3.5 billion, 3.5 billion people that we can address, and a $30 billion service obtainable market. I have the best team in the world to make this happen, but everybody says that, so we'll talk a little bit more about why that is. So this is the fourth technology that I have commercialized. Before this, I built 2 factories, had overview on an innovation portfolio of more than $100 million, and I scaled and implemented the only sustainability technology that is the only technology in the world that turns biomass or wood or agricultural residue into things that compete with fossil fuels. And I bring all of that 20 years of experience in what makes successful innovation into this, because this is what all of that was leading up to. It's like all of my career unintentionally led me to this, and this is my mission in life now. My co-founder, Jared, is a thought leader in the wearables and hardware space. He has 20 years of experience in operations and leading large teams. Jennifer Chambers is our Chief Medical Officer, and she is the former Chief Medical Officer of a health insurer or a payer, Capital Blue Cross. And what that, remember I talked earlier about how we are actually selling to peers. She gives us an unfair advantage into understanding how our customers think while also providing medical oversight. Cam Jacobs actually scaled Lark Health, a diabetes unicorn, um, to the diabetes the unicorn that they are today. And so he's helping us when we actually sign contracts, we get to acquire members with him. Earlier this year, we joined Doug Roy joined us as the SVP of Business Development, and he helped to scale revenue 10 times at Medscope, which led to its acquisition by Medical Guardian. And our senior team is ably rounded out by Salman. Salman loves sound and digital signal processing. He loves how things sound and he's always studying it. And he helps us to do the stuff that interprets what we're doing. We have a financial year which starts in June and ends in May. So for 2025 financial year, we're on track to deliver our revenue projections and then keep scaling as we grow into our contracts. Our current round is led by Sapphire Partners, and we talked already about how generous they were in allowing everyone to have the same deal terms. They have more than $1 billion in assets under management and are really a hardware-focused company. And this round will get us into $5.5 million of annual recurring revenue, an AI expansion, and IP beyond respiratory as we look to cardiology. The second largest investor in our round is Eric Allen. So Eric Allen is the former chairman of Welch Allen, which is like if you go to the doctor's office, you see those medical devices everywhere. That is that 100-and-something-year-old company that he successfully sold, his family built and he successfully sold in 2015. King's Crowd Capital, which is one of the largest and most respected entities in crowdfunding, has invested in us. And we also have investments from a family office called Crabtree Capital, another crowdfunding AI-driven fund which uses AI to determine what companies they should invest in, D3VC, and Chloe Capital that backs female founders. Because if you're not exposed to this space, female founders have a really tough time raising capital and they focus on female founders. And what we see as an exit possibility is really that ability to be like Omada, which recently IPO'd for 1.1 billion, or Hinge, which IPO'd at 2.6. And that's what we're looking for in terms of our exit. And with that, I'll close it off. On the left here, you can see some of our member testimonials for easy reach. You have the QR code and my email address. One of the things that I understand differentiates me as a founder is I email every single person who's invested in us on WeFunder. All 472 of them have received an email from me. Only 100 of them might have responded, but out of that, this is what I love about the community round. We have gotten so much help from our community, so many ambassadors. We've actually had people like join us as advisors because they've been so on board with our mission. So even if you just want to say hi, share a story about somebody you know with this, you have my email. I'm all about building community. It's not just about the money. I want you in my community to help us as we change outcomes for so many people. I'll stop talking there. I actually took a lot of time. Thank you, Tawana, and happy to take questions now.
This is absolutely wonderful, Sharon. Thank you so very much. The great work that you guys are doing. As the mother of a child that used to have asthma, I understand those late night. I don't know why it only happened at night, right? You'd settle in for the night, and then all of a sudden the wheezing would start. And then we were at the ER.
Yes.
A lot of nights of that. This solution is amazing. And I love that it's going to truly change lives and help families. I love that you said, it's going to allow for joy to exist where typically it doesn't. Also, as the wife of a respiratory therapist, I
Ah,
understand the importance of respiratory care as well. And so just what you're doing, when I saw this campaign, I knew we had to have it highlighted here at the 10K Project because this is the kind of campaign that this community deserves to have in their portfolio. And so to all of you I hope you enjoyed this presentation this evening. Please do your due diligence and consider adding this into your portfolio. Um, I want to talk a little bit about some of the things we talked about. And guys, this is a good time for you to put your questions in the Q&A, but I like to go first. So I'll ask a few questions. Um, I love that you're focused on outcomes, right? That you didn't stop with we can predict, right?
Yes.
I love that you took it all the way to say, okay, and then what? And so, because that is oftentimes not oftentimes, that is always what's needed, right? Because the prediction is one thing that's great, but then so many people are lost to what happens after that. And I
Yeah.
love that you've tackled that and you've put um, resources in place to help the families really, get to the next level of that. The other thing you said that was interesting is you said you're scaling to exit. And so you're very clear about that. I want to talk a little bit about that.
Mhm.
Do you, as a company that is intentional about the goal, right? The
Mhm.
scale to the exit, what are you thinking? Like who would be the perfect company to purchase you? What does that exit look like?
Yeah. All right. So this is the part where I always have to be told, and I have to say it, all forward-looking projections are not guaranteed, so that my team doesn't yell at me, but these are not guaranteed. But our thought process is one, we want it's going to be interesting to see who can acquire us. There are different buckets that they are in terms of the who, and then I'll talk about the mechanism. So there's no denying that what we do is what we gather is a very unique data set, and we actually do it very well. So there's a possibility that one bucket could be people who are looking at data and different types of data. So that could be an acquirer. Think the Googles, the Apples of the world, right? The other thing we think about as a bucket of who could acquire is those, say, any digital health company that has recently either IPO'd or who has $1 billion valuation, but now they're in a very neat, a very focused verticals like, say, diabetes or MSK or other things. They will penetrate those markets, but they need to grow. So we see that as a vertical of somebody who could invest in us, people who need to grow beyond a digital health company that needs to grow beyond and show growth, or even to grow into a valuation, which is a big deal now. And then the third bucket that we think is a little bit remote is either a medical device company or a pharmaceutical company who wants to get our device and either add it to their portfolio or pair it with a drug. I personally believe, and again, there is no validation for this yet, that second bucket is where we get people who are very mission aligned, and that would be my preference as the founder for a mission aligned exit. In terms of the structure, again, no guarantees, but our preferred structure is to really go deep and long and far with respiratory and then form joint ventures for cardiology and gastroenterology that then we can share, spin off or license off so that there is the potential for more than one exit. Again, not guaranteed, but that's how we are thinking about it so that we continue to accrete value for the shareholders.
Very good. Thank you very much for that. I want to talk about the patents.
Mhm.
15 patents filed, 10 pending. For the
Mhm.
ones that are filed, how do they how what do they have or what do you have that sets you truly apart from the companies that have some wearables already?
Yeah. So there are 15 that are issued globally in 4 patent families, and they cover the design and functioning of the wearable, as well as a relatively unique way in which we attach it to the body. And then our AI patent, which we recently filed. So those are the 15 that are already issued. Uh, 4 to 6 patents that we are going around the world and getting coverage for. And there are 2 that are still in the US only, one of which is our AI patent, which we recently filed to cover our autonomous AI agent that we're building with our proprietary data set.
Wow. Very impressive. All
Thank
right,
you.
let's get to the community. All right, if you can stop sharing your screen, so we'll be
Yep.
bigger on the screen.
Mhm.
Let's see what the chat's saying. Great
Oh, we
pitch.
have.
I like this idea. Wonderful job. I can't wait to get my email from you, Sharon.
And that's, oh, send me an email and I'll respond. I
I
do see
love it.
we have one from Gaitan. Am I saying that correctly? Yeah. Uh,
So Gayton says, do you see the likelihood of this amazing technological approach being adopted in healthcare settings like nursing homes?
uh, Great question, Gaitan. And the answer is going to be it depends. So we we have had very little success in provider systems, even nursing homes, as long as there is fee for service. Because we just fundamentally don't increase their billable or reimbursable amounts. However, in skilled nursing facilities where we want to augment the insights that nurses have daily, there is a potential, but I'll be honest, that's not on our radar now. There's a lot that we can do with just people who pay.
Yeah. So the focus really is on the payers.
Yes, yeah, and the people who pay for healthcare.
Paying the claims. So
Yes,
think employers, think healthcare systems. Yeah, very, very
yeah.
good. Gayton
And
also says, do you have intentions of making the data adaptable to ubiquitous technology like phone and smartwatches?
that's always a great question. So the easy answer to that is there are two technical reasons why that's difficult. Audio is actually a data and battery hog, so it actually drains devices like those very quickly, but also the data is bad data because you're not listening to the deep organ sounds unique to the individual. You're capturing ambient sounds, and then you're using a lot of processing and battery power to capture those sounds. Then you have to use a lot to filter them out and figure out what is the right signal for you. We have a very effective solution. So we actually flip that um, conundrum where actually our device has a huge processor, huge in terms of capacity, processor on board it. So we actually view it as a processing hub. You can actually use signals from the watch, the phone, and however many other gadgets you want to wear in your body and use this as one processing hub. Because what we do that is also highly differentiated is we process on the device. Your phones and all of the other stuff, they actually stream raw data to the cloud and then stream a result back down. So think about people in Wi-Fi deserts, people in manufacturing settings, people who just may not want audio streaming to the cloud, listening to everything that's going on around you. That's the unique feature of us. We do what is called edge processing, where things are processed on the cloud. I'm sorry, on the device,
On the
not the
device
cloud.
itself.
Yeah,
Right.
yeah,
Right. Wow. That's pretty smart. I mean, thinking about you really eliminate that middleman, so to speak, and
yeah,
just using the device. One of the things that you said that I thought was very interesting is how far it can predict out.
yes. Mhm.
What's the relevance of like 3 months seems like a long time I mean, one day will save lives, but the fact that you go out 3 months, how
Yes,
how did that become the amount of time?
yeah. So there were three clinical studies done at the University of Rochester in um, teens with asthma, and the results were published across three peer-reviewed journals. And teens with asthma have to be the most recalcitrant population on the planet. They know everything about everything and want nobody to tell them anything. But what they did was in a very rudimentary form of the device, they asked them to just wear a lapel-based mic and see if it could track their coughing. And the key to that is there is the resolution and precision was not there, but there was still enough data there when they could identify what was the teen's cough for the teenagers themselves to say, hey, we didn't know how bad our symptoms were, validating the theory that nobody's aware. But then when they tracked them continuously based on their symptoms, they saw that up to 3 months later, the ones who had more symptoms as tracked by the data were actually showing up at the ER. So what they showed was predictive validity for healthcare utilization. And that's where the 3 month came on, because up to 3 months later, the ones that were having those high symptom levels actually showed up at the ER. And so my takeaway from that though is you don't want everybody walking around worried well. Because I mean technically you could say everybody's 3 months away from having an attack, right? But that's why we talk about that window. It's so key to get the symptoms when there's just that little blip. And so you can keep quelling them and bringing them down.
Ah, wonderful. Jackie's asking, what's the price range for the device?
Ah, great question. So it depends on who is buying. Okay. But so we don't sell the device only. We sell the service, the Nightingale service, because we are very cognizant that people may think, oh, I can just, we're changing behaviors here. I don't want people buying the device and saying, oh, it'll tell me when I'm having an attack and everything will be okay. No, no. You have to become an expert at this. And we have a truly innovative business model where I want you to actually like not need my respiratory therapist a lot anymore. You can keep the device, but I don't want my respiratory therapist to have to keep like talking to you, and you don't want that as a patient, and we don't want that because we need to scale, right? So we sell this service direct to consumer. You can visit one of our websites and you can get it for $529 per year, and happy to give a discount to anybody in the Bet on Black community. If that's of interest, email me. We can get that done. But when we're selling to employers and peers, what we do is a mix of that as well as working on contracts to get a share of the savings. So that's the part of the answer where we say it depends.
Very good. So if you save them, I don't know, $2 million on claims, then you
Yeah.
get a percentage of that savings.
Yes, that's what we're working towards now. Yeah.
Wonderful. Very, very good. And thank you for the discount offer.
Yes, happy to give a discount. Just
What
let it
other
add.
questions do you guys have for Sharon? Your presentation was so thorough and you covered everything.
Hoping, I'm hoping that's it, and that's just that they would like, oh, we fell asleep. She was so boring.
Nope, not at all. And I love the soapbox. I tend to stand on mine from time to time. So I loved that you stood on yours.
I have many.
So do I.
Yeah.
And thank you for covering just the variations and how it affects races too, right? And kind of where we sit in that. So often, we get left out of the conversation. And so I love that you put us in the forefront of the conversation tonight so that we could see how it affects various communities.
Yeah. And that's key to us. I think Tracy mentioned that she recognized my accent was Trinidadian. I mean, Trinidad is a kaleidoscope of people. And I always tell any of my ad agencies or anybody, like even our WeFunder page, I need to see me and I need to see a rainbow of people
Yeah,
in. And yes, Tracy, absolutely. Trinis, I mean, it's just interesting to me that, there isn't a lot more of that.
yeah. One of the questions we like to ask is, the raising of the capital is one thing. We understand the importance of that. But so often companies also need other things. And so what else do you need?
Ah, that's a great question. We need everybody talking about us. And we need, it doesn't matter to us if your employer has 10 people, 1,000 people, 2,000 people, we'd like to have a conversation with them because as employers, offering benefits like these, where asthma is the most prevalent childhood disease outside of cavities, it's important for employers to be able to understand as yeah, share. So, but not just for capital, but also for business, because we are happy to work with very small employers or large employers to help them offer a benefit to their employees that really is meaningful because it gives back parents or loved ones just peace of mind. And then if you work at a payer organization or you know anybody who is working in a managed care organization, anybody working in value-based arrangements, we like business. And business means your investments do better. And I'm hoping we get some investments. So that is what we need. And I see we have two more questions. Yeah.
Very good. Anonymous says, sorry if it was already asked. Is there a time period projected for exit? Yes, it was a very thorough presentation and the information on WeFunder is great. I agree with that, Anonymous. You know, we've seen a lot together as a community. We've seen a lot of campaign pages. And imagine how many I've seen because every campaign I see, I don't bring to the community.
Right.
This is the best
Oh, thank
campaign
you.
page I have seen in 5 years of doing this. It
Oh,
is so detailed, so thorough, so well written. It's just very thoughtful. And so but that was the first thing I noticed is wow, they really took the time to put together the perfect campaign page. Like for anyone who's not clear on how to do due diligence, start with the campaign page. Like everything you need to know is absolutely there. Yeah, so
thank
thank
you,
you so much
Joanna.
for that,
I
Anonymous.
work with a team, so I'll be sure to pass that feedback on to them.
Yeah,
So the time
wonderful.
period for exit um, is, again, those, I have to say, future projections are not guaranteed, but we're anticipating that at least one of the exits that we mentioned, and we talked about potential multiple exits, would happen by 2028 to 2030. And yeah, what are we planning to do with Sounds for the Heart and Gut? So Anonymous also asked, can you tell us what you're planning to do with Sounds for the Heart and Gut? Exactly the same as we do for the lungs. Find a disease where people need help, surround the insights that we provide with the available care, and
Mm,
then work with people to make them become experts at managing that condition. So, and we'll just rinse, wash, and repeat.
repeat,
As we,
right?
yeah.
Wonderful. What are the questions that you guys have? Want to make sure we get all your questions answered before we give our call to action. While you're all waiting for your final questions, I'm going to go first and then I'll let Sharon close us out. Obviously here at the 10K Project, we're an investor community. The goal here is to build a portfolio, build wealth, that can sustain for generations, right? That's always the goal. But we want to do that responsibly, but we also want to do that with companies that are mission based, right? That's always important, right? And what you're doing and how you have really thoughtfully built this organization is very, very impressive. And so, what I will say to this community is please take the time, always do your due diligence, right? Same way Sharon gives her disclaimer, I'm always going to say that one, right? Always do your due diligence. But don't wait if this is something you want to add to your portfolio. We see that Sharon has already gotten very, very close to her goal. I am going to make a prediction that this campaign will not make it till September before meeting that goal because of how thoughtful they have been, and because of all of the things that they've done to really build this so that it doesn't just do the prediction, but everything and all the support that comes with it. It's very, very obvious. And I can tell you as an HR professional, right, a 30 plus year HR professional, who I also just told you, mother of a child that used to have asthma, right? Wife of a respiratory therapist. What you've built here is absolutely
Thank you.
needed and wonderful, and employers are going to be knocking down your door. So yes, we need to be talking about it. We need to be saying the name. We need to mention it. If you have friends in HR, if you are in HR and your claims and asthma is in your top 10 spend, right? Which I know it is. You
Yep.
need to be talking about this and you need to be reaching out. And so as an investor, I can only imagine what this company is going to do simply because I can see what it's going to do from an HR standpoint. A
Mhm.
lot of and productivity. Think about productivity, right? I talked about my child going to the ER, right? He was younger then. There were a lot of days I had to call in the next day, right? Because we
Yep.
all know the experience in the ER. You're there
Yes.
all night, right? And we just talked about the fact that it always happened at night. So literally you're there all night. Nobody's getting up in the morning to go to work or school. And so you have productivity issues. So on top of the claims cost,
Yes.
you've got that productivity cost that also has to be added in there.
Yes.
So employers are going to be looking for solutions like this. Um,
Yep. Exactly. Did you look at my sales pitch,
I
Tawana?
didn't,
But that's
but
exactly
I
what we
get
talked
it.
to them
But I
about. Yeah. Yeah.
absolutely get it. I absolutely get
Yeah.
it.
Yeah.
Gayton says, are insurance companies heavily sought after? I can see a great ecosystem being created there.
Yes. If you're talking, I want to make sure I understand the question. Are they the target customer? Yes, they are our target customer. And we already are making inroads there, but healthcare sales cycles are 12 to 18 months.
Right.
So, yeah.
Yeah, I can definitely see the big players though. This can set them apart.
Yep.
All right.
All right.
Um, Jackie says, I'm at the age of investing more into healthcare and health techs. Jackie, so am I. I agree 100%. Again, recession proof, right? One of the things Sharon said when she started is we take 20,000 breaths a day, right? I mean, 20,000 breaths a day. And for the people who struggle to take those breaths seamlessly, this solution is going to really, really change lives. And as I think about all the ways that you're going to grow this, I mean, she just said it, right? Anything where she can take the sound, right, and apply it to a disease. So make sure you guys are listening and paying clear attention, right? Think about all the sounds your body makes. And then you just think through that yourself, and you can bet that her team's already got solutions for it. So
We
very
do have one more question about where our devices are manufactured. So Anonymous asked, where are our devices manufactured? So we do manufacture in the US. I want to be transparent. We issue a purchase order in the US to a Rochester-based company. There are only 2 or 3 foundries that can actually make the chip that goes in to our device. And right now, those are manufactured overseas, but the company that we contract with does that. And then we bring it over and everything else is done here.
Very good. Very good. Any other questions, guys? All right. I'm gonna let Sharon close us out, but you know how I feel. If you're interested, act. This is not the time where we can take our time and procrastinate. If you are interested in building wealth and this is a campaign that resonates with you, you know, you understand the assignment. That's why we're here at the 10K Project.
Yeah, Jackie, we do
Sharon, how you
have,
want to close
sorry,
us out?
Tawana, we do have one more question from Jackie. Do we have time if I answer it?
Oh, you absolutely. I see it popped in.
Yeah. So we're manufacturers in the US. I have a tech background. So we are based in Rochester in upstate New York, and I like to tell people Rochester is still a place where we make things, not just code. And we have our manufacturer right now is based in Rochester. In case you're thinking about scaling, we have a full design for manufacturability site file and that we can pick up and port into any manufacturer across the country. And with our global ambitions, we can also manufacture at the point of sale when we expand globally as well.
Oh, that's good.
And
And
device,
Anonymous says the lifespan. What's the lifespan of the
yeah,
device?
so we've had devices from in the field since 2019 that are still working. Our official documentation says 3 years.
Okay. Okay. And then you simply get a new one at the end of
Yes,
3 years.
yep.
Perfect.
All
Perfect.
right. Okay, well, thank you.
I guess I've got a question that
Uh-huh.
just popped in. Have you, oftentimes you identify early in the process how you can upgrade a
Mhm.
device. Are there things you would love for the device to be able to do, and you see like a 2.0 and you don't have to tell us what that is because the patent's probably still pending on that. But
No, well,
but have you already identified like a 2.0 or a 3.0
yeah,
version?
our 2.0 version is actually the prototype run is taking place now. And yes, we do have a lot of increased secret sauce built into there that will help our AI and visualizing things, but that's about all I can see until we've tested and have the data to file our new patent. But absolutely. And version 3 of our app, sorry, now we're on version 3 of our device. So that is what's being prototyped. To prototype, then version 4 of our app is going through the approval process in the App Store.
Very good. Okay.
All right.
All
And
right. So
so
now we'll let you close it out.
all right, and I just wanted to say thank you guys for all being so welcoming. I appreciate you very much. Remember, we don't have a lot left on the WeFunder VIP section if you're a WeFunder VIP. But what I also want to tell you is there's a reason why I'm a fan of the community round. Growing up, my parents would have been what you call the working poor now. But then we just called it living paycheck to paycheck. And there was very many times where my doctor said to my parents, okay, buy the meds, don't pay me. Or else some really bad, difficult choices would have had to be made around even getting gas to go to work. And what I see and why I resonate with Tawana's mission and the 10K Project's mission is this is what like, and what I'm doing the refund around for is this is for like people who, like my parents, who couldn't get the financial advisor, who couldn't do those things. And I would really just love to have you be a part of my community. And yes, give us capital, but also help us spread the word because this is something that affects people of color and we really need to change it. But thank you for being so welcoming and just feel free to reach out anytime.
Sharon, thank you so very much for your time and thank you for the work that you're doing, for all of those parents that are going to not have to sit in the ER all night. I thank you on behalf of them and everybody else that you're really saving the life of and thank you for turning, this childhood illness that you had into a success story for others. It's really meaningful. And I love that you've made this your mission. And so thank you so much. And thank you for trusting us and allowing us to come along on the journey. We really appreciate it because we are just everyday people here. So
Thank
thank
you
you
so
so
much.
much,
And so
Mike.
am I. If you had asked me growing up if this was what I was going to be doing, never knew. So have a great evening, everyone, and thank you.
You as well. Thank you. Bye
Bye
bye.
bye.